Pneumococcal disease is a common and often mild infection, but it can sometimes result in serious health problems. These include a middle ear infection, a blood infection, pneumonia, or bacterial meningitis. The bacterium Streptococcus pneumoniae S. pneumoniae, which is also known as pneumococcus, causes pneumococcal disease. Invasive pneumococcal disease is a life-threatening condition that is fatal in 10% of cases. Older people and those with underlying medical conditions have a higher risk than others of serious complications. Regular vaccinations can prevent many types of pneumococcal disease and the potential complications that may arise. Types: there are two main types of pneumococcal disease, non-invasive and invasive, with non-invasive being the less serious. Non-invasive pneumococcal diseases: pneumococcal disease can cause a mild infection, bronchitis, or a more serious illness. These occur outside the major organs or the blood. S. pneumoniae can spread from the nose and throat to the upper and lower respiratory tract. The bacteria can cause otitis media. This causes inflammation of the middle ear. Symptoms usually include fluid in the middle ear, swelling of the eardrum, and earache. If the eardrum becomes perforated, pus may drain into the ear canal. Bronchitis: acute bronchitis is an inflammation of the airways, resulting in a cough with the production of mucus. It usually lasts up to 3 weeks and often affects children below the age of 5 years. Sinusitis: this is a common condition causing inflammation of the sinuses in a person's skull. Its symptoms include pain, swelling, and tenderness around the cheeks, eyes, and forehead. Invasive pneumococcal diseases: invasive pneumococcal diseases (IPDs) are more serious than the non-invasive type and occur inside a major organ or in a person's blood. Examples include bacteremia: a bacterial infection of the blood causes this condition and can be fatal. It often progresses rapidly to sepsis. Symptoms include fever, chills, and reduced alertness. Sepsis: this is a potentially life-threatening infection response by the body. Symptoms include fever, chills, clammy skin, confusion, a rapid heart rate, difficulty breathing, and severe pain. Meningitis: this is an inflammation of the meninges, the three membranes that cover the brain and the spinal cord. Symptoms include a stiff neck, a headache, confusion, sensitivity to light, and a fever. However, symptoms can vary, and some may not appear at all. Pneumonia: this is a serious lung disease. Symptoms include chest pain, difficulty breathing, a cough, a fever, and chills. Other infections that may occur are osteomyelitis, which affects the bone; septic arthritis, an infection in the joint. All IPDs need urgent medical treatment. Diagnosis: when diagnosing pneumococcal diseases, a doctor will ask about the symptoms and carry out a physical examination. Depending on how serious the symptoms are, and which part of the body they affect, the doctor may also recommend some tests. Tests may include a chest X-ray. The image produced by an X-ray may reveal a shadow that indicates pneumonia, or fluid in the pleural cavity, also a sign of pockets of pus called empyema. Lab tests: a cerebrospinal fluid test (CSF) by lumbar puncture can detect meningitis. The doctor may also want to test the person's sputum, plus fluid from the lungs, joints, bones, around the heart, or fluid from an abscess. If the infection could be serious, doctors are likely to begin treatment and prescribe a course of antibiotics before they receive the results of these tests. If you like more videos, just share and subscribe on this channel. Thank you.